Ashley, my name's Wendy. I'm a registered nurse, certified diabetes educator here at Rideau Community Health Services. And I was just wondering how I can help you today.
Well, I'm just here to get any education I can about my new diagnosis of type 2 diabetes.
Okay. Well, one of the first things I'd like to cover with you is the importance of annual exams and routine blood work and why they're important. Is that okay if we go into that?
Absolutely.
Okay. So one of the most important things to know with your diabetes is, do you know what your hemoglobin A1C is?
No one ever mentioned that.
Okay, so that's the test they do every 3 months that gives you an average of what your blood sugar has been over that 3-month period. It's like checking your blood sugar 24 hours a day, 7 days a week, and coming up with the average. And we know to protect your blood vessels and maintain your health, the ideal is for your hemoglobin A1C to be between 6.5 and 7%. So I recommend, it's very important you do your blood work every 3 months to check that and know your number. Know what your number is. If you know you're below 7%, you're good. Now that's just for the hemoglobin A1C. To check your cholesterol levels, they should do your lipid profile on a yearly basis as well. And we also like to make sure your kidneys are functioning well because they filter the medications that you're taking and the toxins and things from our body and process from the food we eat. Ideally, you want your kidney function checked on a yearly basis as well. Any questions about any of that? Okay. The other thing that's very important is your eyes. Their blood vessels in your eyes are very small and they can be damaged from having high blood sugars over many years. So we do recommend that you have a visit with your optometrist every 1 to 2 years, or based on what they recommend for you. They'll dilate the pupils in the back of your eyes, look at the blood vessels, make sure they're healthy and there's no damage from having diabetes. Okay. Next thing that's important is your feet. You don't want to forget your feet because there's something that's called neuropathy that can happen, again, if you've had high blood sugars over many years. And that's a numbness, tingling, burning, or pain in your feet, and sometimes your fingertips that can progress over time. So a nurse or your primary care provider will do what we call a monofilament test with a little plastic probe where we'll check your feet for sensation to make sure that it's adequate and safe. And the recommendation for that is yearly unless you're advised otherwise. Okay, any questions about that?
No.
The other test that's important is an ECG. It's a tracing of your heart just to see what your heart rhythm and function is like, and that's recommended every 3 to 5 years. So along with doing all that work on blood pressure, blood work, eye exam, foot exam on a routine basis, the other thing that's important with managing your blood sugars is diet, exercise, and medication. Again, the combination of all three are going to be what helps you maintain your blood sugars at those target ranges we keep talking about. What do you do for exercise?
I do some yoga, usually most mornings, but it's nothing too strenuous.
Okay.
And then I walk my dog twice a day for 30 minutes.
Excellent. Would you say that walk is at a brisk pace? Do you
Yeah.
can talk comfortably, but you feel like you're...
Definitely.
Okay, that's wonderful. The recommendations for exercise are 150 minutes of brisk cardiovascular activity with some strengthening and resistive training like you do with the yoga on a weekly basis, and that works out to 30 minutes a day. And we know when you do that, you lower both your blood pressure and your blood sugars over a 24-hour period. So I'm really happy for you, Ashley, that you've been able to incorporate that into your life. And how about diet? What do you understand about diet and eating with diabetes?
I don't really know. That's why I came here today, honestly.
Okay.
I don't really know what to eat. Online, people are saying carrots have too much sugar. I don't know what to do.
Okay. I'll go through a few points with you today, and then I'm going to refer you to one of our dietitians because they'll give you a much better explanation of how all this works. But the basics I'd like you to take away from today is that it's important to eat carbohydrates and protein at each meal. Do you know what carbohydrates and protein are?
Carbohydrates would be like breads, pastas, rice.
And fruits.
Okay.
And dairy products, okay?
Okay.
And protein?
Protein is like chicken, beef, eggs, that type of thing.
Right. Yep. And think of nuts, think of cheese. Those are also good sources of protein. So we know if you have a combination of carbohydrates and protein spaced every 4 to 6 hours apart, during your waking hours, so breakfast, lunch, and supper, that will help you maintain balanced blood sugars. So those are the important factors to take from that, okay?
Okay.
So we've covered exercise, we've covered diet. The other thing you can do to know you're in target or to see how your body responds to a meal you eat, I always pick on Chinese food because I'm pretty sure it probably makes our blood sugars rocket. So to do monitoring at home, it's with a finger poke, with a lancet and a glucometer, and I'll send a prescription to ask your doctor to send a prescription to the pharmacy for you for that. So the target blood sugar before you eat a meal is between 4 and 7, okay? 2 hours after you eat a meal is when your blood sugar is at its highest point. And ideally that number should be between 5 and 10. Okay, if you're checking and you see that your numbers are consistently between those, then you know your A1C is going to come back in that healthy range of 6.5 to 7%, which is what's helping you maintain your health. Okay, any questions about how to check your blood sugar or why you would check it?
How often do I have to check my blood sugar?
Good question. So for someone such as yourself who's only on metformin right now, minimally, we suggest checking once to twice a week. And what we recommend is picking a different meal. So one day pick breakfast, the next time pick lunch, the next time pick supper, and check just before you eat your meal, 2 hours after you eat your meal.
Okay.
Then that tells you how you're responding to the food you're eating. And if you're curious, what does pizza do to my blood sugar? What does Chinese food do to my blood sugar? And check just before and 2 hours after those meals, and you may be fine, or you may go, not going to eat that once a week. That's going to be a treat once every few months type of thing. Okay.
Probably eye-opening to do some testing.
It is, and it helps you determine what times of day your blood sugars might be higher, the impact of food on your blood sugars. It really does help you plan how you're going to move forward with managing your diabetes.
Okay.
Do you have any other questions for me?
I don't think so. I'm just making sure that I can still live long life, see my grandkids and all that, and whatever I have to do to stay healthy is what I want to do. So
Perfect. By doing everything we've just discussed and reviewed, we know your risk of developing the complications associated with diabetes is minimal, next to nothing over the next 10 years. So with your diet, exercise, medication, and doing your routine exams, you're doing a fantastic job. Keep up the good work.
perfect. Thanks, Wendy.
You're welcome. Nice to see you.